All right, welcome everyone. My name is Krishna Udaikumar. I'm the Executive Director of Innovations in Healthcare, and it's my great pleasure to welcome you all to what is now our digital annual forum for innovations in healthcare. I want to acknowledge that this is a difficult and uncertain time for many of us around the world as we deal with a situation that's changing by the hour and by the day with the COVID-19 pandemic, and we want to be sensitive to that. And we'll certainly try to address some issues that are relevant for all of us that are trying to take care of our loved ones, our communities, and our patients as we go through the next few days and weeks. We also want to thank all of you for engaging with us. We know that for many in our community, our regularly scheduled annual forum in person is a highlight of the year and an opportunity to really make connections and build stronger collaborations. On 6 days' notice, we're going to do our best to try to create a compelling digital experience over the next day. So we thank you for joining us, and also thank you in advance for your patience as we work through what you see as our improvised studio here, which also serves as our conference room. So thanks for being part of our community. Thank you for joining in, and let's get started. I want to spend just 5 minutes giving you context and background for what we're going to do today and tomorrow. And I'll start with our next slide by reviewing who we are and what we do. So as Innovations in Healthcare, our mission is to increase access to quality, affordable healthcare worldwide by scaling leading innovations. And our vision is a world where innovation improves health for all. And we think that's as timely as ever with the state of the world today. One of the major ways in which we operate is to scout for and curate some of the best health innovations around the world. And to date, we have amassed an affiliated network of 99 innovators operating in over 90 countries. You'll hear from some of the newest members of that network over the course of the next couple of hours. In 2011, we were founded by Duke Health, McKinsey & Company, and the World Economic Forum, and we're hosted at Duke University in North Carolina. And we partnered closely on the Duke side with the Duke Global Health Innovation Center that allows us to deepen the evidence base, advance policy analysis, and also to expand our education training and capacity building. Next slide. As I mentioned, you'll hear today from the newest members, our 2020 Innovator Cohort, which are focused especially on applying advanced principles of digital health and data science to improve health and healthcare globally, as well as some leading models that are addressing the growing burden of mental health in different parts of the world. You'll see the logos here on your slide, but you'll also get to hear directly from them. And so we'll get straight to that in just a couple of minutes. What we do across Innovations in Healthcare, as well as the Duke Global Health Innovation Center, is really focused on different ways to scale innovation to improve health worldwide. So everything from sourcing, strengthening, studying, and scaling health innovations, designing and implementing, as well as evaluating global health programs, trying to create and share regional market insights, delivering capacity building and training programs, convening ecosystem leaders to develop breakthrough solutions, and also developing and implementing evaluation tools to help measure and improve impact. What can you expect today and tomorrow? Well, today we're going to have two major areas of emphasis. The first is to introduce the 7 new members of our Innovators Cohort in 2020 and part of our broader network. And secondly, a timely discussion on addressing mental health challenges that will be from 11 to 12 today. And then tomorrow, please join us again. We're going to have 3 major topics of discussion. The first is on innovating primary care for value. The second on how we can better deploy the principles of data science to drive value in healthcare. And the third, a timely discussion on COVID-19 and innovation from some of the leading thinkers operating in this space. And we're going to use this opportunity that we've gone to a digital format to think about how else we can stay digitally connected with all of you and many others as we go. I want to take a moment to thank all of our sponsors. Our work wouldn't be possible, this digital event, as well as our coming in-person events down the line wouldn't be possible with all of our sponsors. So Amgen, the Pfizer Foundation, Dynamic, Takeda, Bayer, Grameen Digital Health. Thank you all for the sponsors. And then next slide, you'll see more of them. Janssen Neuroscience, RICO, Linked Foundation, and our strategic partners, the U.S. International Development Finance Corporation, as well as USAID. So before we get started with the next session, just a few reminders. You'll see on the Zoom webinar format that we're using that you have two buttons on the bottom. One is a chat function and the other says Q&A. Please use the Q&A function to send questions that will be answered by our panelists and our speakers as we go. The chat function you can use to report any technical issues to our IiH team. You can also send messages to the panelists or to all of our attendees, but for more engagement opportunities, please do also engage through the Whova app. You will have, when you registered for the event, gotten the instructions on how to get to the Whova app to our 2020 Digital Forum event site. You can post on the chat function here if you need help in activating that, but Whova will give us an opportunity to engage in much more substantive and dedicated ways. Our hashtag for the event is IiH Forum 20, which you can use on social media when you're talking about the conversations here. So with that, it's my pleasure to welcome one of my team members, Judd Staples, who serves as our Assistant Director for Partnerships and Engagement, to lead us in our first session to hear from our 2020 innovators. Over to you, Judd.
Right. Thank you, Krishna, and good morning, everyone. Thanks for joining the annual Digital Forum with us. My name is Judd Staples. As Krishna said, I'm the Assistant Director of Partnerships Engagement. Next slide, please. So for the last 9 years, Innovations in Healthcare has been sourcing leading innovators from across the globe that are having an impact on human health. Our network of innovators are working in all parts of the healthcare delivery system, from workforce training, care delivery, products and technologies, and system support. Currently, our network is at 99 different companies across the globe in more than 90 different countries. This year, we're pleased to introduce the 2020 cohort to the Innovator Network, 7 companies at the forefront of mental health and digital health. Next slide, please. So we'll be starting off the session with 3 companies in the digital health space, followed by 4 companies that are leading the way in mental health, also leveraging digital health technologies. We'll be giving each of our innovators 10 minutes to talk. We'll have an opportunity to field questions to them after each of their talks. Please feel free to enter those text or those questions in writing using the Q&A button, and we'll get to them at the end of their session.